Here the tympanic membrane perforation can be seen in this left ear anteriorly with some extensive tympanosclerosis in the periphery of the tympanic membrane. The operation begins by rimming the perforation using a rosal needle, and this encourages neovascularization around the edges of the perforation. A curved rosin is used to create the rimming and then straight alligators or cups to remove the perforation. A beaver blade tympanoplasty blade, the 7200 blade, is used at 6 o'clock and at 10 o'clock to make the initial incisions with an angled beaver tympanoplasty blade used to connect the two. Note the bleeding in the vascular strip, which is from injection of 1% ropivacaine mixed with adrenaline to 1 in 100,000. A neuropathy is used just at the medial edge of the tympanomeatal flap to allow the blood that's formed to fall down onto the neuropathy and keep the operative field clear of any blood. And the tympanomeatal flap is dissected. As we approach the annulus, the chorda tympani can be seen here with the posterior malleolar spine, and then heading inferiorly towards the 6 o'clock position, the annulus is removed from the bony sulcus. Using a drum elevator, the thicker tympanosclerosis is elevated from the posterior tympanomeatal flap, and a meringo-incudopexy can be seen where the tympanic membrane is attached to the short process of the malleus, and on closer inspection after lifting up the tympanic membrane, the erosion can be seen on the short process. The completion of the tympanomeatal flap elevation occurs using a short, sharp pick and incising the posterior aspect of the malleus and the periosteum through here from inferiorly to superiorly, and then lifting the tympanomeatal flap antero-inferiorly, removing the short process cartilage cap, which allows us to enter into the correct plane over the malleus. The tympanomeatal flap towards the umbo often requires sharp dissection using straight or curved to the right scissors in this instance, and this is the complete elevation of the tympanomeatal flap. Cartilage tragus is formed with a slot for the malleus and with a periosteal cup to cover the short process of the malleus as well as the scutum. This cartilage is placed down the ear canal and under the tympanomeatal flap, and it sits as an underlay anteriorly, an onlay over the malleus, and an underlay posteriorly, with the periosteum covering the exposed short process and the scutum to ensure no exposed bone is present. The tympanomeatal flap then is replaced with a sucker, ensuring that the edges are everted so that no epithelial pearls are formed. The patched tympanic membrane perforation is noted here with the sucker, and the area is packed with oxidized cellulose in the form of gel foam soaked in ciprofloxacin, as can be seen here. Thanks for watching.